Hello and welcome to COVID-19 Local Impact. I'm Dan Malta from the Your TV Peterborough studios. We'll start the show off today with a look at the COVID-19 stats in the region. In Peterborough City and County, Hiawatha and Curve Lake First Nations, as of yesterday at 4:25 p.m., 44 confirmed positive cases, 749 confirmed negative, with 221 still under investigation and 10 resolved to this point. In the city of Kawartha Lakes, as of today at 1:30 p.m., 84 confirmed cases with 29 confirmed deaths. As part of that one confirmed outbreak, 25 of them in long-term care homes. In Northumberland County, as of today at 1:30 p.m., the number staying pat from yesterday with 13 confirmed cases. A reminder, these numbers are fluid and may change as the day goes on. And tomorrow we'll have an update from Peterborough's Medical Officer of Health, Dr. Rosanna Salvaterra. She'll give her weekly briefing from the Peterborough Public Health Unit. With Ontario Premier Doug Ford's announcement last Friday allowing some construction projects to continue, Peterborough-Kawartha MPP Dave Smith defends the rationale of having some construction workers still exposing themselves to close working distances.
One of the challenges that we have in construction is we also have a large population of people who for various reasons, they may have sold their place, they may not have another place, they may be coming to Ontario from someplace else, and we need to be in a position where they're not living on the street. And it's finding the appropriate balance then. How do we get this construction done so that people have a place to stay?
Before Premier Ford's announcement on Friday, some projects were in limbo, waiting for such things as environmental assessments, some other approval. Would this not be a time for the provincial government to fast track and go through all those open projects right now, get them approved, so once this pandemic has calmed down a bit, that it's full steam ahead and people are able to jump into projects? Is the government willing to do that?
It's an interesting thing to take a look at. Right now, our focus is making sure that we're reducing the number of infections of COVID-19, and the vast majority of our resources at the province are being spent on COVID-19. I'd love to be able to say that we can divert people to do other projects right now, but the reality is we need to be taking people from other projects and bring them into COVID-19 to make sure that as we move forward, we're in the best position to make sure that the lowest number of people are infected.
Summer in the Kawarthas means festivals, and lots of them. MPP Dave Smith says the Ontario government is looking at how they may be affected.
So a lot of our festivals are scheduled to start at some point in the summer. Everything is being done on an ongoing basis. The declaration of emergency gives us a 2-week window to make changes as we move forward. I think it's reasonable to say that all festivals need to be looking at what they can and should be doing as we move forward. We're not in a position where we can officially cancel them because the declaration of emergency only gives us a 2-week advance notice on anything. And that's probably not a bad thing. You don't want to have a government have extended powers like we currently do under this emergency and have them for an extended period of time. Minister MacLeod, though, last week held a number of roundtables with a number of different festivals, organizations, and tourism organizations to find out what their needs are moving forward, what their drop-dead dates are for various things, and how we can support them if this continues on. And I think that we'll see more information coming. In fact, I know there will be more information coming in the short term.
Cottage and RV season is right around the corner, and Kawartha Lakes Mayor Andy Letham says there will be some changes this year. He also reiterates there is a burn ban in effect, and though it is normal for this time of year, it's more important than ever to adhere to the ban.
Good afternoon. Today is Tuesday, April 7th. I hope you are all holding up okay under these challenging times. I want to update you on a few new items under the province's recent order of emergency declaration. The first being that trailer parks and campgrounds are not allowed to open for recreational purposes until further notice. Another update from that same order was regarding short-term rentals. Airbnbs and cottage rentals for recreational purposes are also prohibited as of right now. Any bookings after April 4th must be for those in need of emergency housing only, like healthcare providers who need a place to stay while responding to the pandemic. Municipally speaking, all outdoor recreational amenities, including boat launches, remain closed. Regular park maintenance is not currently happening, so please don't leave your garbage beside our trash cans. That is considered illegal dumping and you can be charged. As you know, we've increased the curbside pickup bag limit to 3, and we're working through plans for our landfill sites and services such as leaf and yard collection, so stay tuned. There is currently a burn ban in place for all of City of Kawartha Lakes. This is nothing new, folks. For over 20 years, we've always implemented a burn ban in April because it's peak burning season. However, what is new is this pandemic, and right now it is critical that the attention of our first responders can be solely focused on COVID-19. This is for their safety and yours. You will be charged if you burn illegally. And we understand it's not easy to stay indoors, especially as the weather gets nicer, and many of you have young ones who are getting very restless. However, we are still under a state of emergency, both provincially and locally, and for the sake of everyone's safety, it is vital that you stay home. We need to ensure we are doing everything we can to help protect our community, and now more than ever, it is important we take responsibility for our own actions. Stay safe, and thank you.
The Government of Ontario has also sent notices to trailer parks across the province, and Your TV has obtained one of these notices from Loon Lake Resort just outside of Madoc, and residents in the park have been instructed to go home if they have another permanent address in Ontario. According to official numbers, no country has lost more lives to COVID-19 than Italy, with more than 135,000 confirmed cases and a death toll exceeding 17,000. Many parts of the country are standing by in fear, hoping the outbreak doesn't reach smaller villages in the south and central regions. Connie Castano lives in southern Italy. She describes a situation similar to what Ontario cottage country may soon be facing.
Hi, I'm Connie Castano. In this moment, I'm calling and speaking from Italy. I live in southern Italy, in Calabria. That is the tip of the boot. At the moment here, the situation is quite relaxed because we don't suffer the same cases and the same deaths that unfortunately we have in the north of Italy, for example, in Lombardy. Here, people are still quite confident and they just feel a little bit more protected. Unfortunately, at the beginning of March, before all Italy was locked up, many people came from the red zones that were considered positive, and during the night they took a train and millions of people came down to the south, Sicily, Calabria, Puglia, Campania. And I think this was an exodus that had to be prevented, because instead of going back, it was not a problem of going back to their homes. They created the spread of the situation. Before that, all the central part and the south of Italy was completely negative. There were no cases. We registered nothing. But after this situation, the cases are starting now to increase. And I think this is starting to generate fear, even here. Calabria is not prepared. It's not prepared, and I hope that there won't be large numbers, because Calabria is not prepared for small numbers. One of the sectors that isn't well developed here is the health sector. I don't think there are the structures, the facilities, and the services sufficient to face a problem like this here. Before all Italy was blocked, ran away from the north to the south, local politicians asked them to stop and go back, because here they would not find a good health service. It was easier to face the problem where they were, where hospitals had many places for the cases, to face the cases, and not here. But they came the same.
Our thoughts go out to everyone in Italy, hoping they're able to stay safe. There are options available to stay in shape without access to gyms. Some of those options are even available for free. Josh Gillum from Hybrid Fitness in Peterborough gives us the details on free online sessions they're offering.
Well, so yeah, we are doing them for free. One thing that we can take from this situation is that it's not just business owners, small businesses like myself that are struggling. It's everyone who's been laid off. So there's lots of people who just don't have that income, don't have that disposable income to try to use on the extras, the things like trying to add to a gym online or trying to add to whatever it may be, delivery services, things like that are still difficult for people who don't have the regular steady income that they're used to, right? So I want to try to create an avenue for them to actually be able to hop online, follow along a motivation workout, so that some of the online programs we've given out, people have lost a little bit of initiative or motivation with it. Like staying at home can be pretty stale for some people, and unmotivating. So what we wanted to try to do is just create some more energy, a better vibe for people that we can be in contact with. They can see our faces, they can move with us, and have that free of charge, at least for the time being, because we know it's tough on everybody. So all people need to do, is email Holly at hybridfhp.com. We've got a link set up for each class. If you email Holly, she'll send you a response email with that link, and it'll set up for your calendar. And then you just pull up the Zoom application either on a computer or on your phone. And then away you go. It'll pull you right into the class. A few here. We've got a body weight ones with myself. We've got dumbbell workouts, mobility workouts, kettlebells, band and body weight, gluten core classes. So we've got kind of an array of them. Right now, we've just got them set up for April 8th, 9th, 10th, and 11th. So we've just got the next kind of 4 days starting tomorrow. We just wanted to kind of give it a trial period, see what classes people are liking, which classes, if they have recommendations, if they have feedbacks, and then we can kind of take it, a few days at a time, launching out some different class options for people. It's through Instagram right now, Instagram, Facebook. We've posted them up on both. I'm also going to probably launch out a few different, videos of myself, just kind of explaining a couple of different classes as we go. Kind of like everybody else, we're kind of changing with the times, trying to offer different things when we can, to try to kind of help everybody out. So, as we progress, the more we'll progress with our ability to reach everybody.
As COVID-19 local impact continues on your TV, we'll hear from Peterborough Mayor Diane Therrien as she addresses an incident at the Peterborough Wellness Centre temporary shelter. Welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. On Sunday evening at the temporary homeless shelter at the Peterborough Sports and Wellness Centre, a male was caught smoking inside the building. Police were called to the scene and the man was removed. Peterborough Mayor Diane Therrien addresses the incident.
That's something that a lot of municipalities are doing, recognizing that the shelter systems in place don't have enough space for folks to properly physically distance. And, that's something that isn't necessarily planned for. Staff are aware that, it's a high needs population, people that sometimes have issues with mental health and addictions. And so I think, we're going to look into that, try to figure out how we can make sure that folks are supervised in a way that they're not, doing damage to the facility. And ultimately, like everything else with this crisis, we'll figure out how to fix it and roll on and make sure that we're taking care of people.
People have been self-isolating in their homes for quite a while now. Are there any reminders that the city wants to give out in regards to the city infrastructure?
And I know it does seem like a long time. It has been a couple of weeks now, and the weather's getting nicer. So, when you're in your home, we're asking people to be conscious, especially about what you're flushing down the toilet. So we had a problem at the water treatment plant with a lot of the wipes, baby wipes, even if they say they're flushable or biodegradable, they really do a number on the sewage system and cause big clogs that we have to go in and fix. So don't flush anything down the toilet that isn't human waste or toilet paper. Again, the reminders are just, the weather's getting nicer. When you're out and about, make sure that you're giving people space, you're being courteous, you're abiding by physical distancing. I know it's really tempting to want to gather in a group when you see people out on the trail, but just making sure that you're maintaining a good physical distance. We're continuing to talk to county, province, feds, just figuring out how we can work towards economic recovery in the long run, sharing information about how people can be safe and access the benefits that are getting rolled out from the province and the feds. So stay tuned for that. And just again, it's a tough time, but we'll get through it together.
There is still a need for blood donations during the coronavirus pandemic. However, canceled appointments and walk-in donations are down at the Canadian Blood Services. Your TV's Mary Tendeshat talked with the Canadian Blood Services Ontario Director Peter McDonald about the extra measures taken to protect staff and blood donors.
Are people still able to donate blood during the pandemic?
Our donor centers are a safe place. We've also added some extra wellness measures during this time. I think what people should know is that, the act of donating blood is the act of a well person to begin with. We are the arm of healthcare that deals with well people. The first question on our questionnaire is, do you feel well today? We're now asking that question actually outside the donor center, along with questions that are consistent with the latest advice from public health. Any symptoms. And if a person doesn't answer those questions appropriately, we don't let them proceed into the donor center. We also have a very robust cleaning and infection control protocol, which we've enhanced at this time by doing it more often. We're focused on the high touch areas that our donors, our staff, and our volunteers would be in contact with. And also we're respecting all the guidelines around physical distancing. So we removed chairs in donor centers that might be in the refreshment area or in a waiting area. We've spaced out our beds so that they respect the appropriate physical distancing based on the advice of public health. And of course, in some cases that might mean that, if we were running an event with 6 beds before, now we're only able to use 4, but we are very much taking enhanced safety measures at this time. And the other thing that we've done is we've discontinued taking walk-ins because, taking walk-ins compromises our ability to respect physical distancing.
If someone had the coronavirus but has been cleared and has now tested negative, are they still able to donate blood?
So in terms of that, I think, as long as a person is feeling well, they're able to donate blood. Someone who's had it and tested positive, I would encourage them to check on our convalescent plasma program, which is something that's just getting off the ground, which holds potential for the treatment of COVID-19 and is something that they could follow up separately as opposed to donating for the regular inventory. They could potentially donate as part of that program.
Is the coronavirus transmissible by blood?
It's not. So all the current evidence indicates that it's not a bloodborne pathogen and not transmissible by blood or blood products.
How is the current blood supply?
As of April 6th, today, our inventory is in a good position. When this started, we issued a national media release on the 16th of March, where we had seen a pickup in the number of canceled appointments, and of certainly, very uncertain time for everyone. That particular week, on a national basis, Dr. Tam amplified that message that the need would go on for blood and blood donation. That was on Tuesday, and then the Thursday of that week, the Prime Minister did the same. Since that time, we've seen a real uptick where we've seen people coming out and respecting their appointments. But I think the important message in that regard is that we're in a good position now, but this is not a sprint, it's a marathon, and that we will need folks, if you go to blood.ca or call 1-888-228, or you download the Give Blood app to book an appointment. If you can't get an appointment because those are booked up between now and Easter, for example, we're going to need you next week and the week after for sure. Thanks to everyone who's responded. Thanks for those who are considering, but also to a shout out and a big thank you to all of our dedicated frontline staff across Ontario who are stepping up at such an important time. It's hospital patients on the other end that people are going through cancer therapy, have compromised immune systems or bleeding disorders, people are in accidents, that the need will go on. So not only appreciation to donors, but especially to our frontline staff as well.
The town of Coburg has made changes to both their conventional and wheel transit systems. Your TV's Mark Rockburn catches up with Coburg Mayor John Henderson to find out more.
As we do the metrics and they're monitored by Public Works Director Wills, we're finding our conventional numbers are down approximately 50% at this point, which is good news, which means people are listening to the message of stay home, stay safe, and respecting social distancing and going out only when they need to. So that's very promising. There was a recommendation this past Monday night in council to reduce the hours for Wills Transit, which council did not agree to at this point. And the reason being because we know we have fewer members using Wills Transit, but it's critically important for their access and their destinations. And as we know, the province has indicated that transit is deemed to be an essential service.
Conventional transit, you're limiting it to 8 people maximum per bus. Passengers must obviously sit the standard 2 meters away, and riders must get off within that 1 hour of, and it can't be the same location where you get on. How will the town enforce these new recommendations that they put forward?
Well, again, to date, without naming details, we've only had 1 or 2 individuals who've taken liberty with what we're asking. If that happens, we have access through the driver to contact our bylaw officer who will intervene. And the good news, if the bylaw officer cannot educate, would be our word, then we have access to Coburg Police Service, who can officially lay a charge, as you know, under the Health Act, because the Health Act under the Quarantine Act, which is effective from the federal government, states that all individuals, whether you ride transit or not, have to abide by social distancing rules of 2 meters.
What measures have been put in place to protect the drivers on the conventional buses, John?
Well, I think one of the greatest is the fact that, first of all, we have no fares in the interim. The transit is free, so there's no handling of resources, money, tickets, passes. That's huge for a driver. Secondly, we're asking all passengers to load in from the back end. And with social distancing, we hopefully appreciate that will enable our drivers to remain safe. If they have personal concerns, then they are to bring those concerns to Colleen McBride, who is our human resource person.
Northumberland Peterborough South MPP David Piccini shares his thoughts on the work being done by the healthcare professionals and what he has learned about the community during this crisis.
My message to them is thank you. This is an exceptionally trying time, there's no doubt, for our frontline healthcare workers. They're doing remarkable work, and I think what we can do to truly show our gratitude for the community is to allow them to do their work. Please do, what community members can do, which is to stay at home, practice social distancing. I was down at the beach a few days ago before the closure and sort of walking along, and I saw a lot of people there when I was on the side streets. And I think we can and must continue to always do a better job at maintaining that social distancing, staying home if to the greatest extent that you can, with the exception of going out to walk your four-legged friends and to do the essentials. But we really the next are going to be critical to flatten the curve, and the best way we can show our thanks right now to the men and women and on the front lines of our healthcare system is to do that. But for them, I'm at a loss for words and what they're doing, hearing the stories on the radio, getting some messages from, I got a message yesterday from a local nurse and what she was doing. I spoke to a doctor yesterday as well. And, I've heard from cleaning staff in the hospitals too, often unsung heroes, unmentioned as well. But my message is one of thanks. I know that they've worked around the clock to clear the hospital, to make sure it's ready. Up in Campbellford, I heard that they really worked at ensuring that they had free beds and have done remarkable work up there. So they're working exceptionally hard and are ensuring that our system is able to meet an increase in need should this happen. And we're all expecting this certainly, to get worse over the coming weeks. I'll be frank with people of this community, and as we've heard from the feds. But from what we can do to show our profound thanks to them is to stay at home and practice social distancing. I knew certainly in our healthcare system when we were one of the first areas selected for Ontario Health Team of the remarkable collaborative spirit in our community, but seeing the Caremongers local Facebook group that now has thousands of members, to hearing stories of local business owners who are, while at home now, or their business may be shut down, dropping off X number of meals a day to people in need or to their employees. Every day there is a new story that almost brings tears to your eyes. So it's incredible to see the community's response. And I always knew we lived in a special community, but if there was ever any doubt with anyone watching out there that we live in a truly remarkable and special community, a rural community, a community where you say hello to people on the streets, where you know your neighbors and you know your local downtown shop owners. That's what's special about our community, and that's what's special about the response we've seen. Be it last night's a remarkable display at the hospital. We live in a special community, and I'd like to thank everybody for being a part of that and for offering a kind gesture to others during these difficult times.
And that's the show for today, and we'll leave you with this. Fleming College presents Together at Home, a music video in support of the COVID-19 Student Emergency Fund and Peterborough Musicians Benevolent Fund. Lost Together, performed by Blue Rodeo's Greg Keeler and a cast of who's who from Peterborough's music community.
That dance around your head. In your eyes I see that perfect word. I hope that doesn't sound too weird. I want all the world to know that your love's all I need, all that I need. And if we're all lost, then we are lost together. And if we're all lost, then we are lost together. Stand before this faceless crowd, wonder why I bother.
So much control, stumbling from one disaster to another.
I've heard out so many times before. It's all a dream to me now, a dream to me now. And if we're all lost, then we are lost together. And if we're all lost, then we are lost together. In the silence of this whispered night, I listen only to your breath. And in that second of a shooting star, somehow it all makes sense. I